Hi everyone. My name's Sarah Nelson and I'm here to talk to you today on the role of women in village level water committees, a Fijian case study. I am a PhD candidate at the University of Sydney, based here in Australia. So it's opposite time difference for me currently. So thanks for everyone attending the talk and we'll get started. So this talk today is part of a wider project called Wish Fiji. And Wish Fiji is watershed interventions for systems health based in Fiji. And it is funded by the Department of Foreign Affairs and Trade in Australia, but also by Bloomberg Philanthropies in the States. So the aim of the wider project is to assess watershed eco-based systems and health system interventions to address the three plagues. And these three plagues are considered typhoid, dengue fever, and leptospirosis. And these are three diseases that are prevalent within Fiji and have major health implications. So the project is across 5 catchments and 3 divisions. And sadly, our team currently based in Fiji is currently under lockdown on the main island of Naivalu because of COVID-19. So hope everyone's doing safe where they are. So just a little bit about our partners, because of the complexity of this project, I just want to acknowledge all of the partners involved. So I'm based at the University of Sydney, but Edith Cowan University and WCS Wildlife Conservation Society also have key lead roles in the project. So just a little bit about Fiji. You guys might not know much about it. So Fiji is an island based in the Pacific Ocean, and it is typically a tropical sunny climate with wet and dry seasons, and it has over 300 islands, and this is based across 4 divisions, so central, northern, eastern, and western. And the population breakdown is 56.8% E2K, which is the indigenous peoples of Fiji, then the Indo-Fijians, which is 37.5%, and 5.7% of other ethnicities. And it is important to note that Fiji is also a highly religious country. So just about the project. So it's a 4-year project that was initially 3 years. It's now been extended to 4 from July 2018 to June 2022. And the project's based in central, eastern, and northern divisions across 5 subcatchments and 28 communities total. So the 28 communities were selected based on the area of concern for leptospirosis, dengue fever, and typhoid. So basically, they just needed to have evidence that they've had an outbreak or they've got an evidence of an outbreak. And they also needed to have a water catchment or watershed, and have links to coral reefs. So just a little bit into the subsection of what I'm going to be talking about today. So it's a qualitative project. And it was based in Central Division, and there are 3 subcatchments of Waibula, Apinavea River, and Daramasamu. And information was collected in 6 communities between August and October 2019 with 40 interviews, and they were conducted by myself and 2 other researchers, Kelera and Vilisi, in English or Fijian, depending on the people's preferences. So who did we speak to? So we spoke to 6 tarangi ndikoros. Tarangi Nikoros are an administrative-based position within a village. Then we've got 6 chiefs, and they are traditional leaders who have significant roles in decision making. Then we've got religious leaders, 7 water committee members, 15 women, 17 men, and 6 healthcare community workers. So just a little bit about the villages. So they were all E2K. They all reported intermittent water access. Half had electricity access, and the other half had generators, and 1/3 of the communities had reported cell phone signal. And as you can see, this is one of the villages here that you can see the electricity line going down. So now about the water committees. So the water committees varied in size, but they were typically had memberships of 4 to 6, mainly involving young males. There was limited female involvement, and when there were, with membership ranging between 0 and 2, we found that community members' roles in the village overlapped. So someone can be a member of the water committee, but also a member of the women's group. And this was felt to be important because it helped with the flow of information and sharing information across the village and the dynamics. And also the Tarangi Nikoro was often the village, the water committee leader. So one thing to note was that within some communities, people couldn't name who was on the committee or who even were the members were. What was also interesting was members were voted for or decided based on their skills and knowledge. So one committee reported that their leader was selected because he knew how to manage the pipes. And membership can also be based on clans. So clans are family-based units. So if there are 6 members, then this would reflect the 6 clans within the communities. So what about the water committee's roles? So we found that operations and maintenance, such as fixing broken pipes and cleaning the dams, were stereotypical roles, and these were reactive and pro-reactive roles. And there was also water conservation during times of drought and communication. The water committee also communicated with the Water Authority of Fiji. So that's the government entity that manages water within Fiji. So as part of this, we also discovered that there were very clear gendered roles. So within the village and the committee. So we found that women's roles were defined as such as looking after flowers and maintaining the gardens, where men's within the village were more likely to cut the grass. So it could be men had more physical roles and women had more softer skilled roles. So in comparison with the water committee, similar things were found where the water committee women played softer roles, where they were involved in the secretary and they were likely to write the report. If they were involved, often they weren't. And the males' roles were more hands-on, such as they would go up and fix the pipes and manage any issues that appeared. And it's thought these differences appeared because, specifically within the water committee, because the water catchment is far away, and it was felt that it was too difficult for the women to get there, or because of the heavy workload, it was thought that women shouldn't be involved. So we also found impact of gender within decision making. So just to add a bit more background, Fiji is a patriarchal society where decision making, we found that social and cultural norms impact impacted the roles that women had in decision making. So just a few quotes to illustrate this a bit further. So it came out that women shouldn't be speaking in having roles in decision making because it's taboo and it's against the Fiji tradition, and it can be seen as them overruling their father-in-law or their brother's decision, and it can be rude. So it's about them respecting where they sit. If they were to be involved, it could be considered rude. So overall, it's mainly men who are involved in making the decisions. Despite this, it was felt that they would like women to be involved in decision making, because women have good ideas and they can help the committee become more active, because we found that although there were committees present, they weren't necessarily active in having meetings. So it's felt women would be able to help share their ideas and work together, because there was the ability of the women to work together in the village and to there was perceived power in them working together because they have collective action. So there is good power in women of those to work together. And also women should be involved as they bring good ideas, as suggested by one of the male participants. Women also felt that they would like to be more involved, because they were the ones every day managing the roles of water, cleaning, and laundry. So they were more aware of the issues and they can help spread the information. So the women felt that they knew more about cleanliness and hygiene than the men did. It was also because, as one woman reported, the men just come home and has a shower and meals. So, and sometimes they forget about us. So it's good to have the women involved as they can help remind us. So thank you for that. So this information has all come from a paper that has just been published last week. So here's the paper reference to share. And I will just, and it goes a bit wider, talking about structures and roles within committees. And I just want to acknowledge the project team. So my supervisors are Joel, Seye, and Aaron. And there's also the wider team who are involved in the data collection. So it's important to acknowledge and thank everyone involved. And this is just the team during data collection before everyone was in lockdown. So I just want to say thank you for listening to my presentation today and am open to any questions.